Hello, am I audible? Hello.
Sir, you are audible.
Okay. The presentation is there.
Audible, please continue.
The screen is being shared. Is it?
Sir, you are audible.
Yeah. The screen. I'll share the screen. Is it? You can see the screen.
Yes, sir.
Right. It gives me a great pleasure to have the privilege to deliver my presentation in the honor of the birthday celebration, which falls today, that is 26 September, of Dr. N.M. Jaisoorya, who was an eminent homeopathic physician and a stalwart in homeopathy. I would like to take his blessings before starting my presentation. Dr. N.M. Jaisoorya was born to an illustrious parents, Dr. Major N. G. Naidu and Mrs. Sarojini Naidu. Everyone knows about Sarojini Naidu. Nobody, but being a son of Sarojini Naidu, it was a very difficult path for him, I would see. At Hyderabad on September 26, 1899, he was graduated in the Oxford Medicine. Hello. He graduated in the Orthodox.
Please accept the speaker. Nobody should open their mics. Please mute yourself so that there will be no disturbance. Please, sir, continue.
Yeah. Then later on, he went to Edinburgh, from where to Berlin to secure the MD from Berlin University. He accidentally came across some homeopathic books and created a deep interest in the studies. With the result, he opened a homeopathic clinic in 1934-35. So he, though from a very illustrious family, he made his own path. See the person, he made a home path and the path for us to really take the services of him, his homeopathy. Had he not been there, what would have been the state of homeopathy in Andhra Pradesh or in India? He was a very eminent fighter for us all. We should be thankful to him, and it has been a great privilege for me to start my presentation on his birthday, that is 26th. Today my topic is autism. So what is autism? Autos means self. An autistic child is withdrawn from the social and emotional interaction. What is that? See, our brain is all a jungle mangle of all nerves. And if we see this is cut, the communication is cut. But how that is lost? Nobody personally went there, used the scissors to cut this, or some accidental things. But we find no history of any injury or anything. But still, we have the kids with autism. The reason is that impulse is lost. How that impulse is lost is because of the toxins go and settle in between. So when these toxins are there, the nerve impulse, the conduction goes down. There's no conduction there. So when the conduction is not there, there's a loss of communication. So autism has three triads. Verbal, non-verbal communication problems are there. Impaired social interaction is not there. There is restricted or repetitive behavior or behavior and interest. These are the three triads of autism. I'm going to show you some of those with the videos. This first thing you see across the child, there's a no name response. I'm calling his name.
आर्यन कम यार आर्यन यहाँ आ जाओ बैठ जाओ
So see, his name was called, still he didn't respond. There's no eye contact.
How are you?
I'm fine.
Karthik, sit down. Sit down.
Sit down. Can't.
There's no eye contact. Again, I show you. Even talking, communicating, but there's no
How are
eye
you?
contact.
I'm fine.
Karthik, sit down. Sit down.
Sit down. Can't.
Then there's difficulty in following the commands.
Nachi, no. Hey, no.
You keep on giving any command to the child, he doesn't respond to it.
Nachi. सारा दिन छत पे ही खेल Nachi, no. Hey, no.
And they express by crying and screaming.
Ashad.
I'm sure you all have experienced these kind of kids in your practice. But when we Google how to treat autism treatment, they say, even WebMD says, there's no cure to autism spectrum disorder. And there's currently no medication to treat it. But some medicines can help with related. Currently, no treatment been shown to cure ASD. But I show you a case, not of a recent, but of 11 years old, 10 years back, 17/10/2011, Niyant Marwaha. He was an autistic child. These are basic, because my topic for today is not about the cases, but I'm just trying to share the case and then go how to approach it. This was my initial understanding around 10 years back. So these were the rubrics which I used to take at that time. Pregnancy history was there, had miscarriage at the age of 16 weeks. So was very cautious. कहीं कुछ हो ना, गलत ना हो जाए, and I shouldn't bleed. So this was in her mind during the pregnancy. These were the rubrics which I took that time, 10 years back. Homeopathy is such a wonderful science. Every day you're evolving. These webinars and all have really helped in sharpening your X for treating these kind of cases. So tuberculin was given on 17th October 2011. So this child is not in India, he's staying in Sydney in Australia. So 1M, then 2013 again, 1M dose was repeated with a number of days. Then 2014, there were more exteriorization of the disease. This is the assessment done from the Australian people. Niyant was referred for a speech pathology assessment by her mother. Niyant has been assessing speech therapy already for the last 2 years, but Mrs. Marwaha wanted an updated assessment of Niyant's language skills. Niyant was diagnosed with autism spectrum disorder. Mrs. Marwaha reported that Niyant was not really talking until the age of 3.5 years to 4 years of age. He is now 4.5-year-old, and Mrs. Marwaha feels that Niyant's language skills have came along a leaps and bounds. So this was 4 years, 6 months, and when he came, he was 3 years old. So now, if I see his history, this is a beautiful video her mother posted about the Niyant, once diagnosed an autistic child, is now a completely cured. This is what homeopathy can do. Being in a normal school, getting all the awards, athletics, conducting assembly. See what an autistic child can do. This is a younger brother, Nihit. Award of Academic Excellence, Library Browser Award. Narrator at the class. Growing up. Athletic Carnival. So on. How many works? A child not able to speak because of autism is now talking in one of the toughest language, that is Sanskrit. That's the beauty of homeopathy. If I show you how he starts speaking in Sanskrit.
हरि ओम नियन्तः नियन्तः उत्तिष्ठतु नियन्तः षड्वादनम् अभवतु उत्तिष्ठतु पुत्र उत्तिष्ठतु उत्तिष्ठतु नियन्तः
So,
हरि ओम नियन्तः नियन्तः उत्तिष्ठतु नियन्तः षड्वादनम् अभवतु उत्तिष्ठतु पुत्र उत्तिष्ठतु उत्तिष्ठतु नियन्तः नियन्तः उत्तिष्ठतु
अस्तु माता उत्तिष्ठामि अस्तु अस्तु
कृपया
see the language he's speaking.
दन्तमार्जनं करोतु
अस्तु अस्तु करोमि दन्तमार्जनम् अस्तु अस्तु
No disease is cured until we have the exteriorization of the disease. He had a severe eczema. You can see through it. We fought it out. The mother was very helpful in treating this case. The patient's level was quite high, very difficult time for them. But the results are very sweet. Another case I'm going to talk about is Pranav Bakshi. He's one of the very famous autistic childs. He had a dream. From here I enter about the homeopathic approach. Fear of loud noises. 3+. Sounds like drilling machine, washing machine, and says machine, switch off. He screams and says, switch off the machine. Can't listen to the crash noise, pressure cooker, drilling machine. These all used to irritate Pranav. And if you want to see what is the result of this guy, he is India's first model with autism.
Hi, I'm Pranav Bakshi. I'm 19 years old. I do modeling for US Polo Association and United Colors of Benetton.
When he was 2, I had started developing an inkling that there is something not right. By the time he was 1.5, his speech had started regressing and he was slow walking and he was losing eye contact. Things were happening, and then I got him a formal diagnosis. He has autism, and at a certain phase of life, he was also diagnosed as having ADHD.
I started photography since 2017.
You can follow him
I
on
like
the
to photograph the
Instagram, or
nature
you can see
and
the
winding
photo
roads.
development he has done in the field of being an autistic, what he's doing now. So our brain is something like this with the frontal lobe, temporal lobe, parietal lobe, occipital lobe, and cerebral lobe. All these have the functioning to organize thoughts on paper, remember facts from the teacher, starts and complete tasks, tell stories, abstract thinking, problem solving. Temporal lobe is for speech, auditory processing, hearing. These all parts have something or the other. Now, when homeopathy, we understand homeopathy in a part that if something is lost, there has to be what is homeostasis is health. If we decrease something, something has to go up. So when there's a conduction disorder taken place because of some toxins going into the brain and not helping the nerves to conduct properly, there's an increase in the sensory issues. Now, today I'm going to enter this thing with the sensory processing disorders. See this child.
Hello,
He
Ajay.
covers the ears from the any sound.
Miku, hello. Hello, Miku.
छोरी नहीं
डर गए उसने पहचान लिया आपको
बैठ जाओ
Child B. Child A was not able to listen anything, chilling, like runner. He makes a lot of noise. Certain kids you come across, they keep on staring to a bright light only. The light, just keep on staring it. We don't understand why. And certain kids, they keep on covering their eyes from the bright light. If we join all these dots, it makes some sense. If the child is not, one child is striking, one child is covering the ears, the others is looking at the light, another one is covering the eyes from the light. So all these autistic children show different sensory issues. Yes, the sensory issues involved in autism, and it has a great importance in individualization. And if we see, homeopathy is nothing but individualization. Dr. Jaisoorya also must have been fascinated by this thing only, that the general things, the allopathy treats the disease, we treat the man in disease by individualization. So he was such a far-sighted person that he had gone to the interest of homeopathy, and hence we are here taking his flag to a new height. So sensory issues help us to individualize each and every child of autistic. There are 7 senses which are there. The vision is there, the smell is there, the taste is there, hearing, touch, vestibular, and proprioception. So if we see to it, all these issues, all these sensory issues are either heightened or decreased. Now, how to understand what is heightened and what is decreased? If a child is making a lot of noise, is because that noise is making his nerves soothe. So he makes a lot of noise, which helps him to soothe his brain. On the other side, if his hearing is very sensitive, he covers up his ears so that the hello. So each autistic child exhibits a unique sensory issues. We understand each and every child, either child sensitivity is heightened or he avoids. Like for him, the child keeps the hand on his ears. He doesn't want to listen anything. He gets disturbed by the loud noise, like of pranav, so he avoids it. Certain or the senses are diminished. Therefore, the child needs and seeks that stimulation to calm himself. For them, the music is very important, or making noise is very important. That actually soothes the child in a way that makes him a calmer child. If you switch on the music, the child is better. If he makes a noise, it's better. Visually, if we see certain kids, they stare at bright light, moving objects like fan, they keep on staring that thing, the bright light, they keep on. So we have the rubrics in our repertory, like the topic for today is, we have mind, like, desire for. The child gets soothing. They keep on looking at the bulb in your clinic or some bright light, and they keep on looking at that with the eyes up. They are just calm, one point, just standing at one point and just looking at the bright light. Certain kids, they are just flapping and needs a stimulation. If you see a child,
डांट के बोलेंगे फ्री मैंने काम करने तो मैंने अपना ही मस्त रहना.
see, this peripheral vision is there for them.
कभी से बढ़ गया.
Sideways, when they flap their hands, they get that gets to their mind. So certain kids, they just can't stand the light. They just cover up their eyes. Their eyes are very sensitive to the light. So we have a rubric, sensitive to light. And we have 19 remedies in them, which helps to individualize the style. Certain kids, they just smell anything and everything, which is odd. Putting their hands under the in their axilla and then smelling it, smelling any food before eating. So what is that? Because their senses are dull, they want certain stimulus for their olfactory. So they always look forward to just take up that smell, which actually helps their olfactory to settle. So in Verninghausen, we have a rubric, smell senses dulled, blunted. So there we can even we can use this rubric. Smell avoidance. On certain kids, you find that any smell, they are very sensitive to smell. They are just smell anything before and they just can't take up anything. They are very, very sensitive to the smell. So just they keep their nose away. Any offensive thing, they just can smell anything, anywhere. So they're heightened. These are smell avoidance. They don't want that smell. It is the avoidance. So we can take a rubric, no smell, sense of sensitive. Because they're very oversensitive to that smell, they avoid that thing. So, am I audible?
Sir, you are audible very much.
Oh, thank you. Another case, I would like to share the one case with you. This child a small child of 2 years used to take a lot of green chilies in the food. I was surprised. But then I understood that the stimulation the child wants, that the mouth taste craves for certain stimulant food like spices. Now see this child, one child is just taking the lemon very easily. For her, taking the lemon is very difficult. Similarly, every texture of the taste, the texture, the food habits, the texture. One child used to eat just the cardboard. That child was always soothed by eating all the cardboards, the books covered. He used to just tear that book and just put it in the mouth. So it was the taste which comes from the papilla of the tongue, wants to soothe that thing. Because they're tasteless. Lots of spices they add to their food. So when you see the kids, their desires and aversions, when they take a lot of spicy food, you can just see to this rubric. Taste avoidance. Certain kids are very avoid. They can't take a new food. They prefer very bland, avoid spicy. So you find out the kids, one side the child is taking a lot of spicy, lot of pungent things, lot of things which are very difficult to take up. But that child is taking because the senses require those things. So now it's things which are out of control, which leads us to individualize the child. which helps us to take up that very, very important rubric that he or she is, senses are so important that we take up that thing. Now, in this, the taste is so acute that it doesn't, everything is very particular. This food has this thing in it, so I'm not going to take this thing. So the mother have to change the food and see to it which ingredient not to be added in the food, where with that the child can take it. So the fussy children again are the indicator for us to what food to be taken, what food not to be taken. I discussed this thing about the hearing part. This is something which you come across the child in a very good form, that lots of kids are there which make a lot of song. So we have a very broad, they will always banging the door, they will bang the table, they will bang anything in their hand, keep on making noise, because their mind is just, they want some soothing to their mind, some soothing to their nerves, so that they are all sorted, so that their things are settled. So we take the rubric that hearing difficult. Certain kids, they just avoid anything. They slight noise, they put the fingers in the ears, screams and sudden noises, not comfortable and becomes angry. It's the same way what Pranav used to be. So even a small stimulus, they become so angry, they become so, just put both of the fingers in the ears. Their hearing hypersensitive compared to sensitive from Morning Hassan. We have these 14 remedies, and if you see all these remedies, they are very important remedies to individualize a child. Certain kids, they just have the impulse. Now, socially, they are not accepted socially. So, what to be done? Why they are not socially accepted? They don't know. They just push a child standing. From nowhere, he hits the child. From nowhere, he pinches the child. So these are all rubrics, are certain rubrics which are not in control. The rubrics which are not in control are very important. They are known as the syphilitic rubrics also. They are things which we can individualize the child by these all rubrics. So we can have touch everything impelled to, or mind impulsive morbid. So the child is such an impulsive that he has no control, but just to push the child. And certain kids are extremely sensitive to touch. One side you have that seeking, that the child has to but just keep on touching them, just to push them. Other side, the child doesn't want to be touched. Touch me not, extremely ticklish, dislikes hair washing, brushing. So, see, what is the thing is that we can go further details, the small details. Because of the time question, I'm not going into very much details of each and everything the child exhibit about the only thing is our eyes we must understand what the child is presenting to you. What are the sensory issues? And each and every sensory issue, only we have to understand in avoidance or seeker. उसको क्यों कर रहा है? क्योंकि उसको चाहिए. वो क्यों नहीं कर रहा? क्योंकि उसको वो डिस्टर्ब करता है. So we have to, just like the thyroid thing, when the thyroid is not manufacturing a sufficient amount of thyroid, the TSH goes up. So when the TSH goes up, it's an hypothyroidization. Or when the TSH goes down, it's the hyperthyroidization. Similarly, in autism, we have to see to it that when the child is exhibiting certain sensory issues, which he is like a sound, like this child is averse to be touched because his avoidance is there. Whereas if he likes to be touched, he likes to be cursed, he likes to be hugged. So there's a need for that. Seeks. So we have to understand what is seek and what is avoidance. You see to it that certain kids, now what happens is that in autistic child, they are very good physically. if they are just maintaining a head. 3-4 days back, a patient came. Bachu ulta, they said that the child head stands very nicely. But that is something which is good. But an autistic child doing that thing is a very, again, a very important thing because it's a vestibular balance. So, what are those sense of balance is there? Maintaining head and body posture, determine the direction and the speed of the motion in a vestibular sensory system. So, what are things? They climb the wall very easily. If you understand that the child, an autistic child, is not communicating with you, he's not taking your commands, but he is physically doing certain things which the animals can do better. The only species in this universe is humans who have the very well developed brain, where he or she exhibits the best of mental abilities versus the animal characters, which is the physical. A human, nobody can run as fast as cheetah, but nobody can think and work as good as human being because of the faculty of mind. In autism, this faculty of mind has gone down, but the physical abilities have gone up. So we have to ascertain that why that physical ability of that child of seeking such a beautiful balance, jumping all around. So these are physical symptoms also helps us to enter the patient in a very individual way. So we have a rubric, and we can see that we have the courageous, fearless, honest. But if you see the history, the Bonnie Hansen repertory, we have bold, audacious, brazen, daring. If you see these kind of kids who are really bold, they can just walk on a thin line, thin wall without falling. So this is something out of the normal thing. So in kids of autism, we have to just see what is not normal, what is out of proportion. Once we are able to see that things are, we are able to understand what to be what rubric to be taken and what area what is he is seeking. Because by doing this thing, by head standing, he is getting his balance right and he is enjoying that thing and he feels good about that. The other way around is certain kids, they are too cautious, they are too scared of the movement, they are actively scared that if you turn that child upside down, it cries like anything. It downward, all these rubrics, they are common rubrics in our repertory, which we don't use in autistic cases, but they are very, very important. Like a child who has the this avoidance, उसको थोड़ा सा भी झटका, थोड़ा सा भी बैलेंस इधर उधर हुआ, panic. So we have the rubric where the cautiousness is there. So many medicines are there. The only thing is that the balance has to be there in a perfect way. They can't any balance, any imbalance. They are panicked. They can't take that. They will scream. They will just howl. They will do any damn thing. But only thing is they to calm them, so they have to be in a balance. They cannot be. You cannot move them here and there. The seventh stimulus is that the senses is of the position. You see, they constantly run into the wall. They just keep on jumping. They can't sit at a place. They kept on jumping. I still remember one of the first cases. I couldn't find a rubric, but the only thing was that the child was exhibiting was jumping, 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 jumping. Nothing else. The whole day, the whole night, he can do is jumping. Couldn't find out what is he doing, why he's doing this. But yes, that was something which was something very important. But now, if we talk to this, a symptom. This is something which has to be addressed. They will keep on running, keep on. They cannot sit at one place. So why? Because of their senses. Because they settle their senses. They feel better after doing all this, which makes them much better. On the contrary of this is they will avoid any activity. you see most of the kids very clumsy. They are just sitting at this work. They are in their own world. They will be doing nothing, just sitting at one place and doing nothing. We take indolence. We see this just sit at one place. They will do nothing. So because of their again the senses, because they avoid, because anything they do that will disturb them. If you take them out, they will disturb them. So to make their senses settle, they will always sit in one place. The sensory issues always individualize one from the another. Though both labeled autistic, all these are autistic, but every senses have. Homeopathy is based on the law of individuals. Every child exhibits its own individual character. So just we have to see to it with what senses are his or her, which are more or less. Sound is vision. Is he looking at something far more, or he is avoiding that? He is hearing. Is he hearing more? He wants more to hear, or he wants to avoid it. Taste. He wants to taste more, or he wants to avoid more. Smell. Does he smell everything, or he avoids smelling? Running, or he's just done this. He's very audacious, very fast. He's very strong, very bold, or he's very, very cautious. So if we do this thing, first to improve after prescribing all these things, first to improve is his or her eye contact. After right remedy, the first thing you see in an autistic child is an eye contact. The eye contact has to be there, because this is the first step for the improvement. Next is, second step to improve is the response to the name. If we call the name, he or she must respond to it. If the medicine is right, second thing to improve is the response to name. Third area to improve is the level of intellect. बच्चे को his intellectual levels, you can understand that the intellect level is increasing or is becoming more dull. He can understand the things. He can do certain things. Fourth step is to find improvement in understanding of expression and emotions. If you talk to him, the smile is there, or understanding is start developing. This step and finally, which the parents are always looking forward. From the day one, they are just after one thing is the development of the speech. Though the babbling starts at the third stage and the fourth stage, but the word formation, the sentence formation takes place at the later on. But the parents are always interested कि बोलता नहीं है, बोलता नहीं है, बोलता नहीं है. So the first thing to improve is the eye contact. You have to tell the parents of the patient that first thing to improve is an eye contact. Yes, abhi eye contact aa gaya na, we are on a right track. Next to improve is your name response. So how many times we take his or her name and he or she responds to your command. Once it starts improving in the name response from one response to two responses to three responses, 3 out of 10 I am saying. Out of 10 times we are calling, 3 times the child is responding. If 10 times he is responding, 4 times, 6 times, 7 times, that means that the improvement is going on. The third area to improve is the intellect part. The intellect, what is the intellect part? Is that the right and wrong things he started following you. The toilet training starts at this stage. What is right and what is wrong? Again, his level of intellect is well. Then we find out that the expression, the smile, if he feels bad about something, he expresses that thing. If he doesn't, he becomes more assertive at this stage that this is right and this is wrong, because then the child starts loving himself. And the first step is always very much welcome and takes a lot of real good time to reach that speech, is the speech development. This order of criteria helps us to achieve the complete cure. Thank you for listening patiently. Now I can take up the questions.
Thank you, sir. Dr. Venu, please look into the chat box and ask the questions in the chat box. Venugopal Gauri, are you with us?
Yes, sir. Just a moment, sir.
Carry.
We do not have many questions in the chat box, sir. But Dr. Nanda, that was a good addition of what are the challenges that are there in autism and what are the different stages that need to be addressed. One interesting question, sir. Do you think what is the percentage of children that we can evolve until the 5th stage?
See, that is again a question that takes a lot of time. Around 2 to 3 years it takes to achieve that thing.
And what is the percentage of
60 to 70% achieve that thing.
Okay. And basically, the biggest problem comes when this problem is associated with neurodevelopment also. So what is the percentage of the children that are able to overcome that stage, sir?
I didn't get your question. Can you repeat the question?
Neurodevelopment.
Neurodevelopment, yes. See, what happens is that now I go a step further. There are two kinds of autism. One is by birth, so something which has to be, and second is acquired. One is primary and one is secondary. So what is the differences from primary and secondary? We are able to treat much better the secondary ones where there's a cause to it. There can be some vaccination to it, some injury to it, that physical injury, that mental trauma after that. The first part is the primary, where we come with the neurodevelopmental disorders, where the things are that at the time of development, that issue has been there by birth. How to differentiate between the child is born with the autistic and one is acquired autistic. The born child will never smile during the course. Generally, the parents come across and understand that the child has some problem only after 1.5 years of age, when his behaviors and his communication is not there. So I asked them, how was the first birthday of your child? What happened? Can we share the pics of the child at the first birthday? So at first birthday, if the child is normal, and after that the things have attained these things, that is an acquired one. And we got wonderful results in that. First thing is, then when it is a primary thing, which is from the birth, so we have to go back to the history of the mother. What did she really feel during the pregnancy? What happened during the pregnancy? And if we go further, there has to be a reason to it. There cannot be something which has come from the air. If we get hold of the cause, what did she actually feel? Now, lots of rubrics like delusions and all have been introduced into in our repertory, which have a second most biggest repertory, rubrics as a delusion. So if we understand that delusion is a perception the mother creates during the pregnancy. So we understand that thing, what happened actually, what was the situation, what is the situation, and try to get hold of that delusion and then take the present addition, we are able to help those kids.
Thank you, sir. Dr. Annapurna has a question. What if the child has been brought to us at the age of 8 to 9 years? What is that we can expect?
8 to 9 years of age. Yes, definitely we can help him or her, but more the earlier, it's easy to train an untrained horse and badly trained horse. So the earlier the child comes to you, yes, we can help the child, but it takes a lot of time because the habits, the things, the toxins which are very easily to be removed from the brain takes a lot of time to come out because of the suppression has gone to such a level.
Right. Thank you, sir. And can you differentiate the rubrics between acute sensitiveness and where the senses are not that or hyposensitive? Dr. Ragasudha is asking.
Can I ask a question? Dr. Bipin here.
Yeah, please.
Sir, what is the percentage of cure when you say in ADHD? Or what do you expect when you say cure?
Sure, I have shown you that the child goes into the normal school, is performing his all duties normally. Now, Niyant is very good in mathematics now. That is what is the actual cure, where I have seen the exteriorization of the disease also. Whereas in Pranav's case, what I have seen is that certain things yet compensated. He's still, if you see his gestures, his talking, you see the tint of the autism with him.
Is there any parameters or some criteria where how to diagnose the ADHD, like percentage wise or the mild, moderate or something, or you have your own something?
See, these things are done by the
occupational therapist.
Yeah. What I have to do is we have to treat the child. That's all. There are certain things that the follow up is there. They are taking the therapies and all. Everything is going on. Only thing is how the therapies are going on without homeopathy. Also, the results are much better and faster when we have this thing. With homeopathy, the training part goes better, the understanding goes better, the intellect goes better, and the speech comes, which is what they are trying to do with the therapies.
Okay, thank you, sir. But in some of my cases, I have treated, you can say around more than 2 dozens of cases. But sometimes medicine is everything is good, but therapist is saying ki his criteria is going down or he is not improving. Sometimes they are telling ki it's improving, but I know ki I have given only placebo. So sometimes I don't know means whether
You have
there is.
the 5 criteria, to see to it. Eye contact is better, name response is there, intellect development is there, the expressions are there. If you see these 5 parameters of improvement, then you can certainly say that the child is on an improvement scale.
Okay.
Eye contact is there. Name response from no name response to 7 times the child is responding to the name. He's on a better side. Intellectually, he's developing.
Okay, sir. Thank you so much, sir.
Emotionally, he can understand your emotions. He can express his emotions. Then the word formation is there from 1 word to 2 words. So, pani leke aana hai, pani la aaye. So from ma pa to formation of sentence to the delivery of the sentence, these all things are there. So we have to. It's not a scale. It's a scale. Every child we have the different scales. How fast he goes and achieves that thing is what our aim is.
Thank you, sir. Thank you so much.
Thanks, Dr. Shukla. That was a good question. In fact, there is an area, high functioning autism, where the academic and the intellectual capacity of the kid is good, but socially he is not able to connect with the world. That is one area probably where I think the other sensitivities we can take care. Dr. Nanda, one more question for you. What do you think is the role of vaccines that can cause or precipitate autism? And if we can find out such a cause, what do you think should be the line of our treatment?
See, every stimulus, vaccination is given to every child, right? So why these kids respond? And why in these kids, what is the role of, what are the senses which are disturbed? His audio or his visual or his taste or his vestibular, what is disturbed? So we take that thing into the consideration. Same stimulus given to a A ball thrown on a glass will give a different sound, on a wood a different sound, on a plastic a different sound. So the same stimulus given at a different places, a ball thrown in the same ball thrown at different places gives a different sound. Similarly, the vaccination given to all the children result in different diseases. In the autistic child, the stimulus, this vaccination given to a child which come out to be an autistic child, what are the symptoms, the sensory issues that the child is exhibiting, which individualizes the child.
Thank you, Dr. Nanda. And Dr. Raj Vikram and Dr. Annapurna again have a question for you. Many a time we see that the child is progressing well, but over a period of 4 to 6 months or probably a year, there seems to be no improvement at all. At such a scenario, what do you think should be the miasmatic remedies that should come into play? Or what do you think would be the predominant intercurrent remedies that would play a good role at this stage?
Reevaluate the case itself. For me, uh, I don't use the intercurrent medicines or the miasmatic. Every medicine has a different miasms, symptoms of different. Now, out of control thing is a syphilitic thing. So I reevaluate the case and understand where the things have not settled. At certain times, you have a very partial indicated medicine. So you have to go back and understand if a calcarea is there, whether it's a or calcarea iod or it's a muraticum or what kind of a thing, or it's some kalis are there, which kali is going to work. If it's a partially indicated medicine, we have to work out that which medicine very closely associated we can just work on it. If we have given calcarea carb, it's given some results, but not complete results. So we have to reevaluate it. What element other than the carbonicum, it can be iodum or it's a chili remedy. Then we have to just look to it with what all medicine we can give to the child. Calcarea phos or calcarea floor or anything.
Thank you, Dr. Nanda. That when you say you don't rely too much on intermittent remedies, you are a constitutional prescriber. And
Yes.
during this last couple of decades, there is a surge of autistic children, especially in the developed countries earlier than us. And India is a mixture of developed, underdeveloped, and all kinds of societies. And do you think any group of remedies actually fall much into this area?
Drug remedies. We have lots of drug remedies in our own materia medica. So we don't find Staphylococcus ignitia mothers nowadays. We have lots of enjoyment ecacities. So lots of drugs are there which help, drug remedies which help morphinum or these remedies which are just in their own world. So what do we do when we take a drug? What happens to the drug? So you are in your own world. You have your own happiness, your own enjoyment. You more of castity, entertainment. So you see, these all things are now prevalent. There are very less people who are where we find out very mild, gentle, meek kind of constitution people who were there in earlier. So there's a lot of transformation in the upbringing of the from the conception to the development to the change of mind. Everywhere we have lots of change in the day-to-day scenario. In ourselves also, this see the menarche of the child. Day before yesterday, I had a child with a menarche at the age of 8.3. So what kind of things we are looking forward? We are going into such a fast forward things.
Thank you, Dr. Nanda. Drug remedies, I think that should be the role of, in the days to come, they will play a great role. I hand it to our convener, Dr. Sampath Raoji.
Thank you, Dr. Gauri Venu. I request Dr. Ashok Patil, the retired professor of medicine and medicine, of Dr. Malakred Homeopathic Medical College, for giving his expert opinion. Dr. Ashok Patil.
Hello, good evening to everyone. Am I audible, sir?
Yeah.
Welcome.
So we had a very good discussion on the autism. Dr. Randeep Nanda made a very good presentation. He started with the very explanation with the slides, and he made us to understand what are the various different senses which are affected and how the child behaves with the both the extremes. One is the visual avoidance, one is want the bright light. So in every sense, the extremes with videos, he explained very nicely. And the most important part is about how to assess the prognosis in the case and how to see whether the drug action is correct or not. He gave us in a very good manner about the 5 steps, where he made us very clear that the first thing to be improved is the visual contact. So the eye contact, which is very, very important. So next followed by the response to name, and then followed by the intellectual improvement, then followed by the reaction to the emotions, and lastly about the hearing improvement. So this is, I think, is very, very good explanation by Dr. Randeep Nanda. So earlier we did not had this in our mind, and when the patients were asking about still the child is not improving, we used to get say disheartened and stop the treatment. But now we can make it very clear that the hearing is the last part to be improved, and followed by his good oration with the video clips. The later part, the question answer session was also very, very important. Many of the questions asked were genuine, and particularly Dr. Nanda they tried to clarify all the doubts in a very clear manner. And one query about the miasm. So sir said that almost I too agree with the sir concept that every drug has one or other miasmatic background. So the drug selected on constitutional basis on individualization covers the miasm. So he finds that there is no need to go for anti-miasmatic remedy. But still, if we do not get the proper response, we may also think of the intercurrent remedies depending upon the background, depending upon the case history. So we can also think of the intercurrent remedies, what I think. So I thank the organizers for giving me an opportunity to tell my opinion and to give to brief the narration. Thank you, sir. Thank you, one and all.
Thank you, Dr. Ashok Patil. May I request our President, Dr. Gopalakrishna Ji, for his concluding remarks. Dr. Gopalakrishna.
Hello.
Hello. Yes, sir. You are audible. Gopalakrishna Ji. Surgery, any problem in the connection? Sir, Dr.
Hello.
Vasisth, sir. You are audible, Dr. Gopalakrishna.
Yeah. I profusely thank Randeep Nanda sir, and we had a very good session. So I would just ask him, there is rise in the incidence world over. So
Yes, sir.
anything we can do, or how do we understand about the rise?
The very hypothetical question, like increase in this is again to do with a lot of medication which is being administered at the time of post the development. There are two kind of autism, the primary and the secondary one. We have seen more of development of the secondary autism because of a lot of medication and immunization and what all kind of medication they have been giving to the child. So the avoidance let the child grow in a healthier way, because we start with the first vaccination. If we vaccinate a child, so what happens is, child is born healthy, we vaccinate with IgG, we vaccinate him, what goes up is IgG-M. IgG M goes up. So once that goes up, what goes down? Something goes up, something has to come down. So IgG-A goes down. So as soon as the IgG-A goes down, the skin, there's a skin nappy rash comes up. So what happens is when the nappy rash comes up, we try to put some ointment to it. So from the disease, from the ectoderm goes directly to the endoderm. The child starts coughing. So we start the progress of the disease ourselves. So the question from the vaccination point, this is the answer from the vaccination, how the disease starts from the vaccinating point. So once then again we keep on giving any medicines for the bronchodilators or something. If the child is born with certain, if something, the pipe is made with some manufacturing defect, and whenever there's some pressure to a point, there's a leakage to the point where there was something we have repaired or some difficulty, something manufacturing disorder is there. So as we all are having cancer cells, it's the circumstances, the area where what triggers that autism, that is the cause for that. I have mixed many things in this answer.
Thank you, sir. Thank you very much. Yeah. And we profusely thank you for a very knowledgeable talk. Thank you.
Thank you.
Sir, Dr. Vasist, sir. Okay. May I request Dr. Raghuram for the vote of thanks.
Hello, good evening, everyone. Dr. Randeep sir, thank you very much for such a nice lecture on autism, about what are the different aspects of autism, the types of autism. You have showed us various facets of autism and different modality treatments of autism. Thank you for a wonderful and enlightenment speech, sir. We all are very indebted to you. We also like to thank the Homeopathic Medical Association of Telangana for organizing such a seminar and exposing us to such a good amount of lectures. I also thank all the participants here who have actively participated and put up the queries for enlightenment of the things. Thank you very much.
Thank you, sir.
Thank you.
So thank you very much, Dr. Randeep Nanda, sir.
My pleasure.
Thank you, everyone.
Pleasure to be there.
Thank you, everybody. Thank you.
Thank you for inviting
me. Again, very soon, Dr. Nanda. Thank you so much.
Thank you, Dr. Venugopalan.
Thank you.